So the field of regenerative medicine is a relatively new field, but the concept is centuries old. As human beings, we've always been searching for that mythical fountain of youth, something that's going to give us our youth back, our young age, our beauty, our ability to be more athletic, or ability to be more active. So regenerative medicine is not the fountain of youth, but it's that first step to potentially reversing or repairing or restoring lost function or lost tissue, or even addressing disease, more than just disease mitigation, but maybe even reversal of that disease. And that's really what people are aiming for, what patients are aiming for, what clinicians are aiming for. So within regenerative medicine right now, we have a few different key components that are utilized for patients. Some of those components may include growth factors coming from a variety of different sources. They may include stem cells coming from a few different sources. Specifically in terms of stem cells, those sources could be autologous, meaning coming from the patient, or they can be non-autologous, so they're coming from not that patient, they're coming from somewhere else. And both options have some benefits. Both options have some, cons or even some maybe additional risks. And it's really up to the patient to sort of decide which one they feel is best. This is assuming that a competent physician is providing the services. Now, but in addition to stem cells, we also have these growth factor products. And these growth factor products can also help in triggering certain signals within the body to restore itself. So what we've actually been able to do for about 6 years now is combine stem cells with growth factors. And what that has done is the analogy I give is it's allowed us to be the gardeners, where we can provide the seeds as well as the fertilizer, hoping that the soil is fertile enough to allow growth. The analogy to that is stem cells would be the seeds and the growth factors are the fertilizer. Now the basement membrane, if you will, the actual tissue that we're addressing, we hope is viable. Sometimes it's not. So for example, if we're injecting stem cells or growth factors into an artificial knee, right, where both surfaces are metal, well that's not very good soil, right? It's not soil at all. And so you're not going to see a regenerative effect. If we have tissue that's hopefully restorable or repairable, then that's when we typically will see some type of regenerative effect. We've had patients where, for example, knees have been bone on bone, and they've actually seen an effect. So the degree of disease doesn't necessarily tell us the degree of response that they'll have with regenerative therapies. We've done regenerative medicine for situations that go way beyond just joint problems, so way beyond knee pain, which is one of the most common places to deploy stem cells or growth factors. But we've also done a variety of areas throughout the body, including but not limited to the spinal cord, where we've actually seen some patients who have had spinal strokes or some patients who have had multiple sclerosis see some disease reversal, see some mitigation of their symptoms, which is very exciting. And I think we're right now probably at maybe stem cell 2.0 or 3.0, or regenerative medicine 2.0 or 3.0. We're starting to see some outcomes that are just really amazing. However, we're also seeing some outcomes that are nothing. And we are starting to understand why, but I don't think we're completely there yet. And we'll have to wait to see what kind of legislation passes and what type of permission we're given in terms of both research as well as clinical application to see how far we can go with this whole line of therapy, this whole field of regenerative medicine.